In this video, we're going to look at some more important x-rays, not only for the exam, but also for the daily clinical practice and emergency department. If you haven't watched part 1 of this high yield x-ray series, I highly suggest you watch that video as well. Moving on to our first super important x-ray, let's say a 67-year-old patient comes to the emergency department with high-grade fever of 104 degree Fahrenheit, productive cough with rust-colored sputum, and difficulty breathing. On his x-ray, you see a widespread opacity covering the anatomical area of the middle lobe of the right lung. The exudate is so widespread that it has completely covered the right lobe, as you can see here. Can you guess what the pathology is? I'll give you a hint. It's a bacterial disease. I hope you're thinking about bacterial pneumonia, specifically lobar pneumonia. Here is another x-ray showing lobar pneumonia, and you can see here as well that the middle right lobe is completely filled with bacterial exudate and it is starting to spread on the upper and lower lobes as well. The diagnostic point for lobar pneumonia is a thick opacity that covers the anatomical location of a particular lobe. The bacteria responsible for the lobar pneumonia occurrence is Streptococcus pneumoniae. The Streptococcus pneumoniae is also the most common cause of meningitis, otitis media, and sinusitis. So we use the mnemonic MOPS for these diseases, for which this bacteria is the most common cause. Sometimes lobar pneumonia ends up in consolidation, which means the lobe gets fully loaded with the exudate and gives the appearance of a solid structure. In severe cases, lobar pneumonia can involve the entire lung, and you need to know how to diagnose it, not only for the exams but also for the daily practice. Before we move on to our next high yield x-ray, can you quickly subscribe to my channel? I will post more videos like these. Let's look at another important x-ray. Let's suppose a 55-year-old chronic alcoholic comes to you intoxicated. You notice that his breath smells so bad, almost like a dead animal. He also has a severe cough with productive smelly sputum. On his x-ray, you see this particular pattern. Look here. There is a layer of opacity, most likely some fluid. Inside the fluid layer, you see a level of air. Again, level of fluid on the outside, level of air on the inside. This sign is called an air fluid level. Can you guess what the pathology is? I hope you're thinking about lung abscess. The diagnostic sign on x-ray for a lung abscess is air fluid levels, as you can see here again. This is a level of fluid and inside there is some air. Always look for air fluid levels if you have a suspicion of lung abscess. Lung abscess is caused by aspiration of contents present in the oral cavity. The classic scenario for lung abscess are the patients that have some form of loss of consciousness. For example, alcoholics often have loss of consciousness, so their protective mechanisms for the lungs, such as gag reflex, are inhibited and they have a strong risk of aspiration of contents from the mouth into the lungs. Similarly, epileptic patients can aspirate the contents of the mouth during an epileptic episode. Lung abscess is mostly due to anaerobes that are normally present in the oral cavity, such as Bacteroides, Fusobacterium, Streptococcus, etc. But lung abscess can also be caused by gram-positive bacteria such as Staphylococcus aureus. Moving on to another high-yield X-ray, let's suppose a patient comes to your clinic who is an immigrant from a South Asian country like Pakistan. He complains of mild fever, night sweats, weight loss, and cough with white sputum. He visited Pakistan 4 months back where his grandma also had similar symptoms. On his x-ray you see a lot of findings. Look here, you can see a bilateral opacity just lateral to the center of the chest. This is called hilar lymphadenopathy. Another thing that you can notice here are small linear opacities that represent fibrous scars in the lung. Can you guess what the pathology is? I hope you're thinking about pulmonary TB. The presentation of pulmonary TB on X-ray is variable, but the most important sign for TB on X-ray is bilateral hilar lymphadenopathy, seen in all these 3 X-rays. Look here, here, and here. Another important clue for TB is the presence of cavitation in the upper lobe of lungs, as you can see here. TB can also lead to presence of fibrous scars seen here. And finally, widespread TB can cause a millet seed pattern seen here, known as miliary TB, which we have discussed in part 1 of high yield x-rays already. Symptoms of pulmonary TB include fever, night sweats, weight loss, cough, and hemoptysis, which is basically blood in sputum. The classic scenario for the exams is an immigrant from South Asian countries like India or Pakistan, because TB is rampant in those countries. The severe widespread form of pulmonary TB is called miliary TB, and I highly suggest you watch part 1 of the X-ray videos for more details. This is another high yield x-ray for the exam and clinical practice. Let's suppose a 70-year-old male with 50-year smoking history comes to you with severe weight loss for 2 to 3 months and having cough with blood in sputum. On his x-ray you see this huge solid ball-like lesion, as you can see here. So 50 years of smoking history, hemoptysis and weight loss with ball-like lesion in the lung. Can you guess what the pathology is? Hint, it is a very, very bad news for the patient. I hope you're thinking about lung cancer. The visibility and appearance of a lung mass depends entirely on the size of the particular mass. For example, here you can see that the mass size is so big it almost looks like a tennis ball. But if the mass is small or if the cancer is in early stages, you often see a characteristic coin lesion as seen here. This coin lesion appearance is super important for the early diagnosis of lung cancer. Lung cancer is the leading cause of cancer death both in males and females. The presentation of lung cancer includes cough, hemoptysis, bronchial obstruction, and weight loss. The biggest risk factor for lung cancer is, of course, smoking, but keep an eye out for other risk factors like secondhand smoke, asbestos, radon exposure, and family history as well. Related to the previous high yield x-ray, this is another important x-ray. Let's suppose a 42-year-old female is diagnosed with choriocarcinoma in the reproductive tract and she is being treated with chemotherapy. 6 months later, you do a surveillance chest x-ray on her and you see that unfortunately the lungs are filled with small ball-like lesions everywhere. Can you guess what the pathology is? I hope you're thinking about lungs metastasis, more specifically the cannonball metastasis of the lungs. Here is another x-ray showing cannonball metastasis and it is fairly easy to diagnose. Lung metastasis can be secondary to any invasive cancer, for example, adrenals, brain, bone, liver, breast, and bladder. Lung metastases are in fact more common than the actual primary neoplasms of the lungs. But the classic scenario that I want you to remember is that of a woman suffering from choriocarcinoma, very high yield for the exam. You will often see the characteristic cannonball metastasis in a survivor of choriocarcinoma. If you're interested in the books that I highly recommend for mastering the ECGs and for reviewing them for the exam, I have pasted the links in the description box, so check them out. Please subscribe to my channel as I will post more high yield videos with commonly tested stuff like CT scans, histoslides, and high yield pictures. We also provide live one-on-one tutoring services, so check the description of the video for contact info. That's it guys, and I'll see you in the next video.